and then magnesium, which is the topic of today's video. Hard to pump up magnesium. Hi everyone, in this video we're going to take a closer look at magnesium, which is not a drug, it's a mineral. In fact, it's the fourth most abundant mineral in your body and the second most abundant intracellular cation next to potassium. And when you're thinking about magnesium, you can think about sodium, potassium, magnesium, and calcium. Those kind of four go together, those minerals, but today we're going to focus on magnesium. Now, a normal mag level, about 1.3 to 2.2 milliequivalents per liter. That's normal. It's either normal, too high, or too low. Hypermagnesemia, and I'm just going to say hypermag for the rest of this video so I don't spit all over the camera. If mag is too high, one, it's rare, and two, it's almost always caused by renal failure. The kidneys are great at getting rid of lots of magnesium. The kidneys can just dump out mag, unless the kidneys aren't working. So if your patient has renal failure, they're going to hold on to that mag. They haven't been dialyzed and they can get a high mag level. The other time I see a high mag level, and mostly in critical care transport, it's iatrogenic. We do it. I haven't done it personally, but we move a lot of patients, a lot of pregnant patients on magnesium because magnesium is a wonderful tocolytic. And tocolytic is a drug that helps to slow uterine contractions. Mag's a smooth muscle relaxer, that's why we use it in asthma sometimes. But it helps to slow these uterine contractions. It can also help to reduce seizures. So in the pregnant population, let's say she developed preeclampsia, starts with a headache, blood pressure starts to come up, it is typical that they'll start that patient on a magnesium drip. So we transport a lot of those, and if you're not watching that drip, you can get into trouble and cause a high mag level. Now, what does a high mag level look like? It starts with neurosymptoms. They get muscle weakness, and a test question, I remember from my flight days, a loss of deep tendon reflex. Is that mag levels coming up? If you're given too much mag as a tocolytic and they lose deep tendon reflex, you got to throttle back on that mag. As it progresses, and you know that 2.3, once we get to about 5, you're running into real problems. You can have vasodilation start to occur, muscle paralysis, respiratory paralysis, all of that plus cardiac arrest. So the treatment is calcium chloride. 10 cc's of 10% calcium chloride would be the first drug we administer. Does that sound familiar? Yeah, it's the same thing we use for hyperkalemia, for high potassium. So you can remember that. We treat both high mag and high potassium levels with 10 cc's of 10% calcium chloride. Interestingly enough, the reason we think it works, and nobody really knows how it works.
Deep! Wow, how do you do that?
Magic.
But we think it's suppressing the calcium, and calcium is needed to cause those strong muscle contractions. Okay, next, the mag is too low. Hypomagnesemia. This is actually most patients that are got a little low mag level, they're asymptomatic. I read a statistic that 11% of all admitted patients have some level of low mag level, and 60% of all critical patients have some magnesium deficit going on. Now, too low a mag, well, that's why we have mag. And as far as ACLS goes, the most associated algorithm would be with Torsades de Pointes. So in Torsades de Pointes, we believe it's caused by the low magnesium level. That's why we're administering magnesium in suspected Torsades de Pointes. Now, when it comes to a low mag level, it's one of two things. Either you didn't take enough in, or you got rid of too much. So when it comes to taking it in, alcoholism can cause low mag levels, starvation, malnutrition, you're just not taking in enough magnesium. Or you're losing too much. GI loss, diarrhea, diuretics. This can cause loss of magnesium and develop hypomagnesemia. Now, looking at this normal magnesium level, when we're talking about magnesium levels, it comes with a caveat that it may not represent the total body magnesium. The reason is, remember, we're only testing extracellular magnesium. Most of the extracellular magnesium floating around is attached to albumin. The other half of your magnesium is in your bones. So at any given time, it's hard to get a true total magnesium level. But we get our lab work and we treat the patient symptomatically also. We're also remember to look at all of our labs. If one is off, another one is off too. So this has been just a quick review of the drug mineral magnesium. I'm Mark, thanks for watching. See you in the next video. And then just plain magnesium. And then just plain magnesium. Hard to pump up magnesium, isn't it?